Why don't we start? I think it's just a minute after 5:30. We have some guests joining us today. Sully is visiting us today. Welcome. You're interested in our current opening, so we'll give you a chance to introduce yourself in a couple of minutes, but thank you for being with us. And we know Sally Manning is here as part of the priority plan presentation. And Angela Sullivan too will be here then for the presentation. So welcome to all of you. I think we're expecting one more guest, Harmony, is that right? Okay.
Yes, that's correct.
Okay, great. All right, well, why don't we start with approving the minutes from May? Can I have a motion for that? Sheila, a second. Khaki. Any discussion about them? Any corrections? Okay, all in favor of accepting the minutes as they are? Okay, looks like we have passed them. Karen, thank you as usual for all you did there. Great. So any privilege of the floor from the board? Any comments anyone wants to make at this point? Okay. And there's no board correspondence. So just moving ahead with my report, the main thing I wanted to do tonight was to introduce Salimar. And if you could just take a couple of minutes to let us know about you, Sully, and if we could hear about why you're interested in the opening we have currently, that would be great. I hope you're there. Okay. I think you're on mute.
Yeah, I am. I'm muted. Sorry. No, I moved because my son can be really loud. So I was just trying to relocate.
Oh, thank you.
Yeah. You're welcome. So my name is Suleiman Peña Vasquez. A lot of people call me Suli. I have no preference, whatever it's more comfortable or easier for you. I have 3 children. 15, 12, and 4, who all came through Ithaca City School District. I personally, at the moment, I work for the Ithaca City School District. I work in human resources, so I assist Mr. Robert Van Karen with 3 other assistants. So I work that as my regular 9 to 5. When I'm not doing that, I run, oops, sorry about that. Did I lose you guys? Okay. When I'm not doing that, I run support groups for women who are having difficulty more with depression and anxiety through fitness programs. So I run that, and that's every month. Usually about maybe 5 to 7 women, new women join the group. I am also on the board for the Tompkins Community Action Early Head Start and Head Start program. I was president for 2 years, and this year I took it back a notch, and I'm secretary. My youngest goes through their Head Start. So I really like to be involved, especially when it has to do with my family or children or, the people in my community, anything that I can be more aware of in order to help, people know where the resources are and such. I am also on the board for the Unbroken Promise Initiative. It is just an upcoming group organization that started when the George Floyd death occurred. So that's still up and coming. And I'm on the PTA for the Boynton Middle School, also as the secretary. So I definitely like to be involved in the community, but more in places where I've received a lot of assistance and help because I'm not as financially well off. So the time is what I have. So I like to give back by, volunteering my time. I really am interested in the board in particular because I personally, I I've struggled myself, and even recently have struggled with anxiety, depression, especially now through the COVID, but also I've had family members who have passed away dealing with depression. And most recently, my brother in January had passed away from an overdose. So there's just a lot of things that are not getting back to the people in my community as far as resources, although now I've learned more. And as I've learned more about what is out there, I feel like there's a lack of like marketing, branching, more outreach. And if some resources were known to some part of Ithaca, I feel like more people would be able to reach out and ask for help. Or if the people that they were asking help from look a little bit more like them, it might be easier to, ask for help. It may not happen because people, it's hard to do that. I've been there. And so just recently, more and more, just mental health and just the wellness, well-being of one has come more important to me because of the things that I have endured. And so I would like to be a part of the group if you guys feel like I'm a great fit, and see how I can help and perhaps be a liaison, to other people in the community, and, and just be able to give back in that way.
Oh, thank you very much.
Yes, thank you.
Any questions?
Yeah. Hi, Sully. I just wanted to clarify which position you were interested in. Your application talked about the substance use subcommittee. Is that where your interest lies, or is it with the board, which is what I thought I was hearing from you as you were talking?
Yeah, so initially when I had first learned, or when I was researching where I could, be of assistance, I saw on the website that you guys were looking for community members for the mental health subcommittee and the substance use. Then after applying for that and speaking with Mary and is it
Stu,
with
maybe?
Yeah, Stu, yeah.
Uh-huh.
Stu had reached out and let me know that there was an opening on the board, and that, to look further into it and to consider participating on the board if that was something of my interest. So I don't know what some of the rules and guidelines are. I would like to still participate if they're still opening also in the subcommittees, since those are the two main, I'm interested in both the substance use and mental health. So wherever I can be, most useful, I'm more than happy to be of any assistance.
Thank you.
Great. Mm-hmm. Thank you. Any other questions? All right. Well, thank you so much. So
yeah, absolutely.
And so we'll have you join us for this meeting, and we'll have an executive session at the end. So that'll be a point when our guests leave. So, but we're glad that you could make it tonight and we could get to know you better. Thank you. All right. Harmony, I'm going to turn it over to you. You've got the bulk of our agenda today. And just so everybody knows, after the presentation and our questions have been answered, we need to take a vote on this plan. And that'll be the final step we'll do after we hear all the information.
Thanks, Mary. So first I want to tell you, if you read the copy of the local services plan that was sent late last week, you will probably find some typos. I got to tell you, I don't know. It is the smallest font in the state system, and there's no spell check. So I went in and cut and pasted it and discovered some spelling and grammatical errors. I've cleaned all of those up and I sent it back to you. So my apologies that you got one that didn't have. I learned that my own personal proofing is nowhere near as good as a computer, and you have a much cleaner version of it now. So those errors are out of it. So figuring out how to do the local services plan review, which is done annually via Zoom, is a little bit of a challenge. So Mary came up with a really good idea, and she said, why don't you have guest speakers come and talk about the different needs that they live and breathe every single day, so that you can hear some of the same information that they may be subcommittee members like Angela, or they may be someone we asked to come like Sally to the mental health subcommittee. So you can hear firsthand some of the information that the subcommittee members received when they made the plan. So I'm going to back up just a minute. And so that's why we have some guest speakers here today, and talk a little bit about why we have a plan, what's the purpose of it, and then a little bit about how it was developed. And then we're going to go right into the format will be, you'll hear a guest speaker talk about the need, take them a few minutes to talk about the need, and then I'm going to put up the part of the local services plan that you received that talks about the goal that was developed from better understanding that need. And then after the goal, there are some objectives that we developed. And so first of all, why on earth do we have a local services plan? So they were developed actually because of deinstitutionalization. So a lot of people remember the infamous deinstitutionalization that took place in the 50s and 60s. People ended up leaving hospitals and they were supposed to get services in the community. But unfortunately, what happened was many of the people never got those services in the community. And it was a huge problem across New York State and across the nation. And so how New York State decided to try and address the problem was to address it at the local level. So they have these state agencies, right, like OASIS and OMH and OPWDD, but they needed some sort of mechanism to communicate at the local level. So they created the Director of Community Services position, and they created the local services plan in order for the state to talk, the state agencies to talk with local providers to find out how are, what are the needs in your community? How well are we meeting those needs through all the initiatives the state has had? So this plan, really, you look at the state gives you some guidance. They don't do their plan every year, but they do a plan as well. And OPWDD is getting ready to start looking at updating their plan. The state gives you a plan that you can review for guidance so that you make sure your goals are aligned with them, but also the goals are that what we come up with in our plan is communicated to our local government officials. It's used to help resource allocation. People can put it in a grant, right? Like you can write a grant and say this was something that the local services plan identified as being really important. So it helps communicate to local stakeholders, to local government, but it also communicates to the state. And what the state does with that information is they aggregate it and they start looking for trends. And they use that data to help them figure out what are the programs that we should be trying to support in the future? Where are the greatest needs that we're seeing across New York State? So we get information from the state and then information goes back to the state. And it lets you know, are the things that you're trying, are they working or are they not working? So those are the reasons we have the plan and how it came about historically to have the plan. And then there's a few tricks about how to write the plan. They give you a whole list of things you can see in there that you can choose from. But if you choose everything on that list, you will not achieve anything, right? You have to be super focused. You want to keep your priorities pretty clear in your head. And that's what I think people were very, work really well together. They work very hard at trying to just figure out what are the things we really think we can achieve in a year, because the goals are big and hard and they're going to take many years to achieve. But the objectives in each of those goals are supposed to be things that you can do within a year. And there's supposed to be things within your control that you can do in a year. So they worked very hard, used their self-control and came up with a very focused plan, because you can look and say, we could have a lot more categories. We have needs probably in every one of these categories. What are the things that we see as most pressing right now? When you hear people talk, you'll see why they are pretty pressing issues. So the information was collected from subcommittee members, from talking to other local government units like this across the state in meetings, and talking personally with different leaders and stakeholders in our community that also gave some feedback. But it really was driven from the subcommittees and their ideas. And then while each subcommittee worked on a part of it, I took all those pieces and put them all together into one plan. So the whole hope is that one subcommittee might be working really hard in the next year on one particular area, and another subcommittee might only have one objective in there, but that subcommittee is going to be working on something else really hard, so that no group has too much work to do, right? That we think this is something we can actually do. And it's still a pretty tough plan to achieve. We may not get through all of it, and that's okay. At the end of the year, you say what you achieved or didn't achieve. So that's kind of the beginning of it. And there are different categories that we started with. The first category is actually Larry's going to talk a little bit about. This came out of the mental health subcommittee as a big area. And we can help you out, Larry. Don't worry, because it's crisis services. And that was the first need area that we identified. So take it away, Larry, on crisis services and why we thought this was such an important area to focus on.
So just so Sully knows, I'm, and other guests who may not know, I'm the chair of the mental health subcommittee. And I don't know if you said what your title is, Harmony. That's why I was raising my hand earlier.
Oh, I'm sorry. I didn't see your hand. I wish we were in a real meeting. I probably would see it there. So I'm Harmony Ayers-Friedlander. I'm the Deputy Commissioner of Mental Health. Sorry about that, Sully.
So Harmony has worked really closely with members of the subcommittee. And this year, the subcommittee decided that our two goals would be a focus on crisis service and a focus on, I think, children. It's listed as other mental health needs. But anyway, Sally will be talking about, and Harmony will be talking about the children's stuff. So last month when we heard that we were having some problems sustaining our outreach team, I immediately, as I am wont to do, wrote to Harmony and said, well, here's what I think some of the goals should be, which are figuring out a way to support and sustain the things that we're doing, figuring out what the gaps are, and having a real conversation about what we think the crisis services, particularly crisis response services, need to be in this community. And I personally have, for the last many years, been saying that we have to figure out a way to be more supportive of suicide prevention and crisis service. So I'll be carrying that little hat as we have these discussions. But Harmony pointed out that I think we need to think more broadly about what crisis services look like. And if it ends up being that we find resources or help SP find resources for their operations, then so be it. But we want to be more open about what we see as a good crisis service, crisis response. And of course, this will be influenced entirely by the reimagining policing that both the city and the county have adopted. It seems to me that we are likely to have something like, if not sort of a exact copy of this thing called Cahoots model, which I think is in Oregon or started in, which state did it start in, the Cahoots model?
Oregon.
Oregon. So a lot of what we'll be doing in this year is figuring out how do we fit in these plans, and then what do we think? I think the mental health subcommittee and the community services board need to have a leadership position in these discussions about what the community crisis response will look like. So that's my presentation. Anything to add, Harmony?
Thanks, Larry. I'm going to share my screen and I'll show you our goals. I think some of the things we also talked about in this particular area was that we know that there's some changes that are happening. Does that screen look okay to you? Is it a good size? Okay. So we know that what Larry was talking about with suicide prevention and crisis services, in 2023, they're going to change to a 988 national crisis number. So that's going to require a lot of changes happening. Like Larry said, we have the reimagining policing change. We also lack some crisis respite services, both for children in our county, that Sally will probably talk about, and also in the OPWDD world. We're the only region that doesn't have crisis services there. And there's a big push this year across the state. Not the crisis services through OPWDD that other regions have actually don't allow people to use them unless they're already in the OPWDD world. So there's a big push that those services allow people who meet criteria to get in the door through a crisis episode and get more access to care. So there's a big push this year for crisis services across the agencies at the state level. So it seemed like a good idea to really focus on this area because we know we have some limitations. And Angela's going to talk about, some of the crisis services, open access, and getting people services for detox and that sort of thing right away as well. So in every one of our mental hygiene programs, crisis has an element that we want to address. So the goal is address the growing need for improved crisis services as measured by identifying gaps in current crisis services that support the new reimagining public safety plan. We know we're not the final deciders, right? There's going to be a Center for Justice that's going to be working closely with the community and more broadly than, just mental health. So but we want to be, looking at gaps and having ideas and potential solutions. Suli, I can see your hand, but I got to tell you guys, call out because I only see like 5 of your names when I share my screen.
But yeah, I'm sorry about that. What are the abbreviations of OPWDD?
Okay. OPWD is Office of People with Developmental Disabilities, and OMH is Office of Mental Health, and OASIS is Office of Addiction Support. Help me, they just changed it, what it means.
Services and supports.
Services and supports. Thank you. I keep calling it its old name. It'll probably take me another year.
Me too.
Good question, Suli. That's why we're not going to look at all this document because it's got a lot of lingo in it that's kind of confusing. But these are the important points. So identify gaps, explore options with community providers and other stakeholders on ways to address gaps in current services offered that are financially sustainable, advocate for additional resources through federal, state, and local funding to ensure a robust crisis response, implement at least 2 activities designed to improve relationships with policing agencies and mental health recipients, and learning more about updating and promoting local service provider directories, 211 services, interactive maps, and brochures to provide information about available resource services to individuals and families to prevent crisis episodes from occurring. So you can see most of these activities are the box that's checked, which subcommittee is working on that, and they're all going to work together. So like OPWDD is really going to focus on, do we know people understand what's available in the first place? I think Suli was just mentioning that there's a lot we could improve on getting people to know about all the services that are actually available to them. So OPWDD and OASIS, OPWDD is going to take the lead on that with some help from OASIS. But, I think once OPWDD subcommittee figures out how to do it, the other subcommittees can kind of jump on their work and figure out how maybe they want to do that as well, like an OMH. But some of the other ones are going to be very specific objectives just to like mental health. Subcommittee is going to be working on, I think, the one that is about mental health recipients. It looks to me like some of these boxes aren't evened out on the screen. So, but the mental health subcommittee is going to be working on doing activities with the police department with mental health recipients, right? That's like specific to that subcommittee. And other ones are for more than one subcommittee. Does that make sense? I feel like I just made it more confusing than it had to be. Okay, I'm going to take silence is good, that one made sense. And now the next category that's in the plan. Elise, I don't see Kimberly on the call. I hate to put you on the.
Yeah, that's fine.
Okay, because the next area is workforce recruitment. That was the next big area.
Sure. So the workforce recruitment has, in particular for direct service providers, in agencies that provide direct supports to people with disabilities. So in this case, is a goal identified through the Developmental Disabilities Subcommittee, but could also apply to, many other areas. That has been a perennial issue for a long time. However, it reached a crisis point during the COVID-19 pandemic. So there has always been difficulty nationwide. There's difficulty recruiting people to very high stress, often very demanding, skilled work that is required of a direct support provider. And the wage is very low. And in Tompkins County, the issue is compounded by the fact that housing costs are very high. So for example, agencies like RACR that operate in multiple counties, they have difficulties fully staffing their programs in other counties, but in Tompkins County, it's much, much more difficult because people can't afford to work for those wages and also maintain a residence. And alternatively, they have a difficult time working for those wages and commuting back and forth from another county. So at this point in time, we have many agencies have reported that they're actually discontinuing lines of service in order to staff their community residences because making sure they have adequate staff in their housing is a non-option, which means that people with developmental disabilities are not getting other types of supports and services as much as they were pre-pandemic. I know using RACR as an example again, which is I believe the only agency in town that serves individuals from birth to death. They have long had difficulty staffing their supports and services, community-based supports and services for children. And so all that to say, this is a crisis that's not getting better anytime soon. And one of the things we hope to focus on in the DD subcommittee this year is maybe engaging the Workforce Development Board in Tompkins County to talk about how we can troubleshoot some of these issues and also how agencies can collaborate better to create workforce solutions. Is there anything else, Sheila, that you can think of?
No, you've summarized that really well, Elise. Just a couple of things. We also focused on the retention piece because there is a high turnover. Certainly that was exacerbated by the pandemic. In terms of going forward, we also talked about with the agencies in our subcommittee, looking at some strategies that are working and having our providers share those strategies to see if they can apply to, across the board or to other agencies. But definitely, as Elise said, the pandemic has exacerbated an existing problem, and it really has been very impactful on services, and certainly there are wait lists and there are community-based programs that are not that have closed, particularly because staff have to be are shifted to higher needs residential settings.
And vaccination uptake has been not as good within the population of direct support workers. And although it has improved and agencies have been trying to provide incentives, agencies have been reluctant to require vaccines, COVID vaccines, because they're worried about a mass exodus of the personnel that they do have. And this is an industry that has always required vaccines. For example, hepatitis B vaccinations have always been required. Tuberculosis tests are required. So there's a lot going on there in terms of workforce.
And that also was tied into crisis because the concern is, as we see a lack of community-based services for people, if you're not getting those services at that level, at some point, you're going to see an uptick in crisis as well. So this was seen as a pretty big need. I am going to share my screen again so you can see the goals and the objectives specific to this area of the plan. So the goal statement here, can everyone see that okay? Just nod your head, okay. Support the implementation of improved recruitment and retention strategies by OMH, OPWDD, and OASIS-funded providers in Tompkins County as measured by a reduction in vacancies and turnover ratios. And OASIS also, when their subcommittee met, the substance use subcommittee met, they also had some pretty significant concerns similar to what people are seeing in OPWDD. So they had added a few objectives in here as well. This is, I think, a shared concern. And mental health services, there are issues around, hiring people as well. And some of the children's programs we're going to hear from, there's just the same kind of workforce shortage there that are in the Office of Mental Health world. And also when you're looking at hiring medical staff or clinical, social workers, that sort of thing, there's a huge problem in trying to recruit and retain for those positions as well. So this really is one of those areas that touches all of the programs. So one of the ideas is to share innovative recruitment retention strategies across funded programs and agencies during monthly subcommittee meetings throughout 2022. The next objective is engage the workforce regional development system to better address recruitment and retention challenges in Tompkins County, such as the Healthy Workforce Network Recovery to Work collaboration. So that is a Healthy Workforce Network Recovery to Work collaboration is something OASIS identified, and the Workforce Regional Development System. And I'm not sure, Elise, if this should say Workforce Regional Development Board.
No, system is good.
Okay.
Yeah.
All right. So, so it's going to be a combined effort there. Like people started hearing when the substance use subcommittee met, they were able to share in all the knowledge that the developmental disabilities committee had already, what you guys had already done. So they were able to add on to it a little bit. And objective 3, implement a data collection solution that provides real-time information on employee vacancies, turnover, and its impact on service delivery. Like that's how we're going to know if we're being successful. Participate in advocacy efforts to highlight the severity of the workforce crisis to secure increased funding for staffing at the local, state, and federal level. And it's a crisis everywhere. It's worse here, but everyone is experiencing it. So hopefully there will be some movement, at the state and federal level. Investigate a plan to attract and relocate skilled workers while also incentivizing current employees to further develop their skills to advance in the career ladder. So this was a specific goal OASIS identified, and there was some discussion about, can we partner with larger healthcare systems in recruitment and retention efforts, people that have, larger budgets for their marketing for and trying to get people to move to our area and that sort of thing. So that was
just one thing to note. I'm sorry, just one thing to note in that regard, Harmony. One of the things that's different about the DD system is that there is no professionalization of personnel. And that's been a problem with direct support professionals and also employment support professionals for that population. There's no credentialing.
So do you think we should add something about advocating for that?
Well, I think it's something to bear in mind, and maybe we can talk about it next year because it's sort of it's a complicated topic in a way.
Yeah, because you don't want to create barriers right now when you have such a shortage, but at the same time, until you professionalize something, it's hard to get it respected.
Yeah, and I think there's pockets of service delivery in the state that's moving toward that, and so maybe next year we can have more conversations about what those are and how we might be able to help it gain some traction.
Thanks. Okay. Any other comments or thoughts on this section of the plan? And I can't see you also, just yell out. Okay. All right. So the next area of the plan, Angela, you do not have a small task here because there are a couple of goals that are substance use disorder related. We have something that some of the goals are like the biggest, those are our top priorities, and some of them are like sub goals, are a little bit smaller, but we still think they're important enough to put in the plan. So there are actually 3 that are specific to substance use disorders. You can take them in any order you want. There's residential treatment services, there's
talk about it all.
heroin,
Yeah.
heroin opioid programs, and then there's prevention services. So if you just want to, whatever you want to give, and I'll fill in the blanks. How about that?
Sure.
Okay. And
the-
Angela Sullivan is the Executive Director of Alcohol and Drug Counsel. We are very happy to have her come and speak with us tonight. And I got it right. I didn't say drug and alcohol. Did you notice? I said
Don't say
alcohol
it
and
that way
drug.
again, you'll forget. A before D, that's how I remembered it for like the first 3 years I was here. So I'm thrilled to be here, and it is no small task, because I think, especially in 2020, substance use disorder and the continuum that supports that, which ADC is one small part of. I don't want to say got pushed aside, but we got pushed aside. There was a lot of other stuff going on. And, as we know, which exacerbated what general has been going on related to substance use disorder. I think I will take sort of the easiest one first, which is
Just
probably
Angela,
the smartest thing. Oh, sorry. Yep.
Can you just say a little bit more about what you mean by being pushed aside?
It just was not the key focus of much in New York State during COVID, right? There were other priorities, other, like, for example, we don't have accurate data since 2019 about opioid overdoses and those sorts of things. So, I mean, not that I'm trying to assign busy work to anybody, but it was really hard to prepare for this, to actually give you something really concrete to know about, because we anecdotally and through our own organizational numbers know that it has gotten worse, but I don't have any shiny charts or exact numbers to give to you to sort of express the scope of the need.
So you're speaking from the state level.
Yes.
Okay.
Yes. And, that sort of trickles down locally. I think we have an embarrassment of riches in this county. I should probably have opened up with that positive sentence, because we have one of the more complete continuums of care in the region, but it is by no means yet complete. And because of some of our more progressive Department of Health and medical perspectives, we responded in ways that saved lives, right? Which, Tompkins County was among the first to have treatment providers provide Narcan, right? When other providers were fighting, saying it was, not the right thing to do, or whatever, fighting Suboxone and some of these things that are now commonplace, Tompkins County was right on the leading edge of all of those things. The one I think I would start with is just prevention. And like in all things, when related to substance use disorder, prevention and information, all that work that goes into developing coping skills and giving people accurate information and talking at it in a holistic systems way is what is both best for the community, the individual, and the most cost effective. There used to be a saying, I'm sure the math is not the same anymore, but when I started 10 years ago, for every dollar spent in prevention, we saved $13 in treatment and other costs, right? So they had this link. So looking toward some of the things that have changed are, of course, cannabis legalization and more widespread gambling activities. And those are absolutely going to have unintended consequences. If you follow any state where any of those things happened, you will find out that it does actually increase sort of public costs as well. And so we are one of 2 licensed prevention providers in the county, the other being BOCES, and work primarily with youth and families to discuss some of the potential risks associated with everything from, whatever, tobacco, illegal drugs, cannabis, alcohol, the whole works. And so it's really more a wellness focused program. Gone are the days, some of us might remember the Just Say No campaigns and all those things. That is long gone in the world of prevention. It really, truly is about giving young people coping skills and information so that they can make healthy choices. And we do not, as the council, we don't provide gambling counseling specifically locally. We work with the regional gambling center. And so they'll be coming and presenting to all the networks so that we can make those referrals and make those connections to them. So I think that that's probably the quickest of the 3 bullets that I have. The heroin programs and services, again, New York State has had record overdose numbers. I wish I could give you those numbers, but I can't. We have anecdotally felt an increase. I don't know that we felt an increase specifically here in Tompkins County, and I'm not going to put Frank on the spot because those numbers are still kind of squishy. But I can tell you that when it comes to what we consider red flags, if you will, of what we need to be paying attention to related to heroin and opioid use in our community, is simple facts like 360 people were admitted to our ER in 2020, or some peripheral urgent care or something connected to CMC. So that was 360 unique individuals. Some of those individuals were more than once. The thing I will say is that in 2021, we are halfway through the year and they've had over 200 admissions. So, and again, those are a little squishy numbers, depends on coding and all that, but it is definitely increasing again. We had worked really hard pre-pandemic to bring some of those numbers down. And so that it is sort of creeping back up again. The other thing is that when you look at the dashboards of the state opioid dashboard, which is, again, woefully out of date, but even the most current numbers from early 2020 show us as having a higher than the region and higher than this, I think, full state. I'd have to pull up that chart again. But essentially, we administer a lot of Narcan, which is a great thing. We're saving lives. And it shows that there's a use pattern that is potentially deadly and extremely risky. And so those are things where other programs, don't use alone and all of those sorts of things, we can put those messages forward. I will say also, I spoke earlier with Jessica Jansen, who's the CEO of CARS, Q Addiction Recovery Services, because they basically launched a methadone program during COVID. It was open a little before COVID, but not much. And they serve about 100 people in their methadone program. So there is significant need related to sort of all levels of the response. We also added another OASIS licensed low threshold harm reduction provider, which was Reach Medical. And so you heard about them and seen them, I'm sure, in other forums. They did a tremendous amount of work out in the community during COVID, and they really absolutely deserve a lot of kudos or acknowledgement for their work that they did during COVID. Both sort of all providers are providing medication assisted treatment for people who have opioid use disorder, but there is not enough of that going on, I would say. We don't have enough medical personnel or licensed personnel who can do that. So that sort of fits into this idea of kind of the next piece of that plan, which is the residential treatment services. And I can talk a bit about our project, which seems like it's been going on since the dawn of man. We are still, and have been through COVID and everything, been working diligently on getting what we sort of in air parentheses call the Detox Program, because it's more than the sort of state-defined hospital-based detox. So what this is, community-based detox. It will have, when complete in 2022, will have 3 levels of care, one of which is open access, which is basically a 24/7 walk-in center for information. They can be seen by a medical practitioner or referred to treatment. That treatment can be outside of our organization. We could refer to our partners, throughout the region, including CARS, depending on what their need is and what the person coming in the door wants. Or we could just hand a Narcan, train and hand a Narcan kit to a family member of somebody who's worried about, their loved one's heroin use. And then the next level of care, which is the really exciting piece, which has not been in Tompkins County for 30 years, Mary, something like that, which is this inpatient, what they call medically supervised withdrawal. And so it's sort of in layman's terms, detox. That is a medical unit, 20 beds, but it is community-based. So it gets people out of that hospital ER and into an appropriate treatment setting. And then the next step, so that's 20 beds. And then there's 20 beds for stabilization. So the first 20 beds is like, get them medically stabilized so that they can actually have more counseling sessions or figure out what they want to do next. And stabilization actually buys them roughly a month. When we first started planning this, we were told we'd be lucky to get 14 days in the whole program for someone. And what they have found is that insurers have learned that if you actually let people complete a program and get stabilized, they don't end up to be high utilizers of other services. And so they have actually extended those lengths of stay. So I think, and then additionally, just it always feels a little weird for me to talk about a colleague, but I think it's also really important to note that CARS will be working also on a 25 bed women's inpatient long-term residential program. And so once those are up and running next year, I'm knocking on the wood of my desk. We will in Tompkins County for the first time, maybe ever, have a full continuum from prevention to harm reduction to all levels of treatment and care. And thanks to our friends at places like Unity House and Community Action, we have recovery housing. So we will have the whole continuum in Tompkins County, which is amazing. And for me, at least, what I would ask, and then what I've seen in the plan is the push to make sure that New York State doesn't lose focus on the fact that we need this full continuum in Tompkins County. And so even though we've been talking about it, like I said, for a really, really long time, it takes a long time to get a state-funded project put together and completed. So is that enough? I feel like I talked too much, Harmony. I'm sorry.
Oh, you had a big task. You had 3 different things to talk about. So I will share my screen. Did anyone have any questions for Angela before I share my screen? We're good? Okay. That was a lot of information. And you basically were the spokesperson for everyone with a substance use program,
Focus.
right?
Yes.
Which is an odd place to be, but we can't have everyone here. So I'm sure they will think that you did an excellent job in describing their program. And I took notes, so I might add a few things to this. But basically what you'll see here is prevention programs. So a couple other things about prevention programs. So they're really directed towards young people, particularly, And so the focus really is on gambling and there are a couple of things that we know have happened during COVID and maybe right before COVID, right? We have had, when kids are staying at home and not going to school, they're more likely to find their parents' alcohol, right? They're not probably getting as monitored as closely in home. So we're seeing an uptick in substance use among kids. Once you legalize a substance, it suddenly doesn't seem so scary or bad, and more people will use it. And the concern is something legal for 21-year-olds is really bad for 14-year-olds. And we have to make sure that families understand that. We just got through a vaping crisis that we're still not through. And a lot of that was parents really didn't have the awareness and knowledge of what was happening. The parents thought maybe vaping was like a wellness product for their child. They really didn't know. So it's a lot of that prevention and education is really important for that. And we also know that New York State legalized online gambling on sports betting just in 2019, right before COVID. And what we know about gambling is that the biggest age group that starts with gambling, it usually starts in adolescence, but going away to college, first time you have your own money, right? And here we are with 2 colleges around us. That tends to be a pretty big issue. It's related to domestic violence later on. It's often used by people who have experienced trauma. So there's a lot of treatment issues and prevention work that we could do in our community that would really support many people here. So the objectives, the goal is prevention efforts, identified areas of increased risk. I feel like something got left out in there. I will fix that. But basically it's to, I think, the first word was supposed to be focus on prevention efforts on identified areas of increased risk for youth in 2020. And I'm not sure where focus on went to, so I'll fix that. And then the 2 objectives are prevention providers will partner with schools and other community agencies to address identified needs, areas through environmental strategies and evidence-based prevention education, and prevention providers will use prevention counseling and early intervention. These are 2 versions of that, Teen Intervene, and is for adolescents, and basics is for college students, activities to address the needs of at-risk youth, young adults to prevent the escalation of substance use or gambling behaviors in adolescents or college-age population. Then under residential treatment services, like Angela was saying, we're really just trying to make sure the state remembers we think this is important, right? The work is being done, but we want the state to know we really think it's important. So providing safe and stable, supportive and rehabilitation housing for those living with alcohol and drug dependence, in addition to having wraparound and other supports and services available, is essential in promoting their chances for the best possible outcomes. We want to promote affordable, safe, and integrated treatment options within Tompkins County, sober housing for those coming out of rehabilitation or are presently in treatment and are in sobriety. Proper housing is critical for their continued recovery. And Angela, you might have some guidance for me and say we could fix that up, so you can let me know. And then under heroin and opioid programs and services, we have explore a full spectrum of supports and services to better address opioid addiction and identify strategies that have been shown to be effective in reducing opioid addiction and deaths. We want to continue focusing on that because we know that the focus has really shifted, right? We had a pandemic to deal with, but we want that focus to go back. And there's a little bit here about what REACH did in really helping support people. What I'm hearing a lot in the hospital is that it's fentanyl mixed in with it, right? It's fentanyl that gets mixed in with the heroin. And then there's also a huge influx of methamphetamine, which wouldn't go into the opioid section, but that they're seeing a big increase in that as well. So we have 2 things we're trying to combat in our community at one time. And now the next stop.
Harmony, can I just say one more quick thing? When you're reading through the workforce initiative, I think you had the Healthy Workforce Network, just to either give it a plug or clarify that. So that was federal money that came into the state. So ADC is the lead organization for that. It's a group of 5 organizations. And so the Recovery to Work is almost like a parenthesis of that. It's us, Challenge Mosaic, Chamber of Commerce, TC3, OAR, I feel like I'm forgetting one. And us, I think we're the 6th. And that actually has received funding, not only from the federal, like there's a lot of resources there. So it is something we should absolutely leverage. So it received funding from OASIS, which is federal funding through OASIS. It received Department of Labor funding through OASIS. And it also has received Appalachian Regional Commission funding most recently to also support that. So it's for both the businesses who might hire people in recovery and people in recovery. So like it's a big thing that we should definitely capitalize before that money goes away.
Yeah, I think that's OASIS was subcommittee was really looking at. You can try and promote the community and get people to come here, but you also want to try and grow your own and get people moving from one level of maybe they're working in a direct care position, but they could do more. And if they had the support, they would move, they'd get more education, go forward. Yeah,
great. I just wanted to make sure.
Thank you. I'm glad you gave more information on that. I try and write notes really fast with these guys, but I tell you what, I leave with my head spinning most of the time. So I'm still learning all the programs.
Well, thank you so much.
Oh, you are welcome. And you can sign off now if you prefer, or you can stay for the rest until we go into whatever you want, because I know that this is a big commitment and poor Sally's like last to go. But Sally is coming up next. She is going to talk about our other mental health area. It's other mental health outpatient services. And the focus really here is, like Larry had said right back in the beginning, is on children. So Sally, you are up.
Great. Thanks, Harmony. So I'm Sally Manning, and I am the Children and Youth SPOA Coordinator for Tompkins County. SPOA stands for Single Point of Answers, or as I am calling myself, Super Point of Answers, since I seem to be getting a lot of questions these days. I'd like to share about kind of 8 areas of concern. The children's system right now has been transformed over the past few years. And so the basic level of support that's available to children and youth with significant emotional health issues is a model called health home care management. That's some positive news. Right now we have 6 agencies, 6 care management agencies who can serve children with Medicaid and provide them with a basic level of care management, linking them to other resources, helping coordinate their care, whether it's medical, mental health, school related, et cetera. So that's a good thing that's happening right now. And we have 6 agencies providing it. The care managers are networked with each other, with me. And so there are a lot of good things happening there. Some of the major concerns are related to the higher level supports. The Office of Mental Health developed supports some great acronyms for everyone. CFTSS, which means Child and Family Treatment and Support Services, meant to be preventive in nature and meant to hopefully give children with Medicaid extra support before they need more. One of the challenges with that particular support is familiar to you. It's a workforce issue. There are 2 agencies who provide, who are designated to provide that support in Tompkins County. Neither one of them have been able to hire a workforce to provide these preventive services like skill building and intensive in-home intervention and kind of a licensed therapist to provide support out in the community. So those are all things that are theoretically available, but not available in Tompkins County. Another level of intensive community support is something called Hcbs, or Home and Community-Based Services. Again, the same 2 agencies, surprise, are not able to hire a workforce to provide these intensive home and community-based services. The goal of both of these kinds of supports are to prevent the need for higher levels of care, or to prevent the need for hospitalization or need for placement outside the home. But again, the agencies providing these supports are not able to hire a workforce. As a result, we have incredibly lengthy wait lists for both those services. Unfortunately, youth can be approved for home and community-based services, but then no support is available once they're approved. they could be seen as needing child and family treatment and support services, but none of those services are available. Some youth have been on the wait list since those services started almost 2 years ago. It's been really, really challenging. A third area of concern is the lack of crisis and respite supports. We have no crisis respite supports in the county for any age child. There are none in our region for children under the age of 10. Regionally, Greater Binghamton Health Center and Elmira Psychiatric Center provide crisis respite through their hospital system for kids 10 and up. But again, youth have to travel outside the county in order to access those respites. Sully, did you have a question or do you?
Yeah, sorry. And I apologize. I'm not sure if I should be asking questions since I'm just a guest, but when you're saying that the workforce, that it's not available in those, is it because no one's qualified to take those positions to assist? Or is it?
Yeah, some of them require certain qualifications. Others are less skilled positions. So it's both.
Okay.
Sure.
Thank you.
So the lack of crisis respite supports is something that I hear pretty much anytime someone contacts me with regard to a concern that they have for their youth. A fourth area is an overall lack of supports for youth who do not have Medicaid. If they have private insurance of some sort, there are a limited number of non-Medicaid care management supports available in our county, 10 slots. And so there are frequently waiting lists for those slots as well. In addition to kind of limited care management for non-Medicaid youth, again, any of the other community resources that don't require Medicaid are often linked to Department of Social Services and some kind of imminent risk of placement. So youth may not meet that criteria, and the family may not want to develop a relationship with DSS in order to access those services. So while there are some additional services, they are limited in their scope, and there are fairly narrow criteria for the youth to be able to access those kinds of services. As a result of all those things that I've just mentioned, we've seen an increase in residential referrals for youth from our area. There are two kinds of residential referrals through the Office of Mental Health. One is a community residence, which is what I used to call a group home, that idea. None in our county, but there are several in surrounding counties. And then the highest level of care, and which has been most concerning to me, is the increase in referrals to residential treatment facilities, which is considered the highest level of care for a youth outside of being in the hospital. And what's really concerning is that in the past year, we've had 4 or 5 youth under the age of 12 require residential care. So it's a big concern. So we can send youth to residential programs if they need it. And then when they return home, they do need those high levels of community resources that we just talked about that aren't available. So the transition home often becomes very challenging because those services aren't available to help the youth sustain the progress that they made while in residential care. The last area that I would talk about is also kind of a larger community issue of a lack of outpatient services. Family and Children's now has a waiting list. Many of the private therapists that I assist families in accessing through the Ithaca Therapist listserv, I used to get a couple of different responses when I put out requests. Now I'm getting 0 responses from any of the private outpatient therapists. And knowing that school will be resuming in September and many youth have been outside of school for the whole year, I think most of the folks that I'm talking to in the schools and private therapists are very concerned about what I've heard, kind of the tsunami that they're expecting in September. So those are the main concerns that I'm seeing. I guess what I would offer in terms of hope is maybe there are opportunities with some of the funding that OMH is receiving because of COVID-19. I've certainly spoken with Harmony about prioritizing, crisis respite and some of these more intensive in-home supports. Maybe there is an opportunity here to work together as a community and look across systems to identify ways to braid funding or pull funding together that's not dependent on Medicaid or not dependent on what insurance someone has, in order to provide these more intensive home-based interventions so that we're not having to send youth off for residential programs. So it's concerning, but I'm always try to maintain some hope.
Thank you, Sally. That was pretty informative status on children's services. The one other thing we did add to that section was adverse childhood experiences, or ACEs. And there's really pretty good research that shows that when children experience adverse things, that they are likely going to be impacted in later life. They might develop a substance use problem, they might develop depression or anxiety, among a host of other medical problems that might follow them through their life. So one of the things we really want to do is prevent adverse childhood experiences, and that when people experience them, to make sure they treat them. And one of the sad things I think about the Children and Family Treatment and Supports model is it was the first time the Office of Mental Health actually had a prevention focus. How exciting is that? And to be able to get children into services before they need, so that they would never need services at a higher level throughout their life, by getting there as soon as you can, and then have the service but not have it adequately supported so that you could provide it in the way you need to provide it is sad. And I'm hoping that work will be done so we can really improve access to these really vital services. So we know that kids have probably experienced a lot of things during COVID-19, during the lockdown. Just the lack of reports to Child Protective Services that has really been quite concerning. We know that the children have been exposed to abuse and trauma that no one's aware of yet. We know domestic violence has gone up during this whole COVID pandemic. So our expectation is we're going to have more traumatized children coming back to school in the year ahead. And we wanted to also work on addressing that and supporting efforts in our community on that. So the goal statement for this area support efforts to increase the availability of a full continuum of care to meet the prevention and early intervention and treatment needs of children, youth, and their
A little
families.
small.
Oh,
It's not as large as it was before.
oh, it needs to be bigger? Okay.
Yeah, sorry,
How's that?
no more.
Really?
Yeah,
'Cause
okay.
that's 240. How about now?
Well, it's just that the screen. I
The
don't know
screen
how to-
changed?
Yeah, the screen isn't taking up as much room.
Oh,
I think it's okay.
is it okay? All right, because I
All
don't
right.
know. I didn't do anything differently, so I'm not sure.
Okay.
Um,
All right.
Support efforts to increase the availability of a full continuum of care to meet the prevention, early intervention, and treatment needs of children, youth, and their families in Tompkins County, regardless of ability to pay, as measured by an increase in service provision. So the first objective is to become better informed about the current barriers to the implementation of services necessary to provide a full continuum of care, explore alternative braided funding opportunities to meet the needs of non-Medicaid youth and their families as they are made available throughout the year to develop local solutions, advocate for improved reimbursement rates for home and community-based services and child and family treatment and support services that require a competitive salary to meet the demand for entry-level and professional workers throughout the year based on identified funding and advocacy opportunities. And this is something the state is looking at because they are seeing this increase in kids going to higher levels of care across the state. So this is an opportunity that we'll probably get for advocacy. Create a learning opportunities for the community to effectively respond to adverse childhood experiences to reduce their impact over the course of a child's life during the 2021-22 academic year. So that is that goal area. We are almost done. You guys must be exhausted. I don't know, Mary.
It was a lot of good information.
There was a lot of stuff in this plan. This is a great idea, but everyone's going to go home and go to sleep.
I'm wondering if we should say that's enough of the review. Do we feel like we have enough of a sense of the plan?
Yeah, there's really only one other, Elise, it was that smaller goal that we developed for developmental disabilities. And then the other things are just saying like we covered that in another area and that's it. That's the whole plan really in a nutshell. I don't know if you want to give a brief to the last one.
Sure. I mean, just in one or two sentences, just identified the need to take a pulse community-wide on what's happened with transition for youth with disabilities during the pandemic and make that a focus of the coming year. Although, transition, post-school outcomes and transition can look a lot of different ways for different people, and there are different indicators of that success. A lot of things went away last year, like work-based learning, for example. And so although, transition requirements under IDEA may have looked good on paper, it's not really clear, what happened in practice. So I think as a subcommittee, we just want to keep an eye on that and keep talking about it.
Okay, so that's it. That is the entire plan right there.
Wow. Well, I really want to acknowledge the amount of work that went into that, Harmony. You did a great job with this, and the input from the subcommittees and from our community guests. This really helped, certainly helped give me a good sense of what the needs are out there and where we're going for the next year. I think we've been concerned in the past that the plan may not be as alive as we wanted it to be, but I certainly get more of a sense that we're meeting pressing needs in the goals that we've identified. So thanks everybody for that. So I think if we had a motion to approve the plan, that would be our next step. Would anyone like to make that? Khaki? And Jan second. And any discussion? All right, all in favor of accepting? Okay, great. Thank you, everybody. Great, okay. So Frank, would you like to give us a little commissioner's report?
Sure, yeah, I'll be quick. Want to echo the thanks to Harmony, the subcommittees, and all our community partners that helped put the plan together. It is great. And coming off of a pandemic year where we pretty much just turned in the same plan again, it was the right time for us to really put that energy to it. So thank you to everyone. One real quick update. Just want to make sure everybody is aware. A meeting or two ago, we talked about some of the struggles with the mobile crisis team. Mainly about their the stress that the team was under. The number of calls has increased both daytime and evening. The need to go out in person has increased over the last few months, and we expect that it will continue in that trend. And we're struggling to get staff that were willing or able to continue staffing that team. We haven't solved the problem yet, but we have some recommendations that we've made to county administration that they've supported around adjusting our contract with labor to be able to offer more compensation for those that are willing to serve on the mobile crisis team. We're still working through the logistics of that. We'll have to work out an MOA with the union to be able to do that, but I don't foresee that being problematic. The goal in increasing compensation is not that just by paying people more, it reduces burnout, because it doesn't work that way. What our hope is that it will attract additional staff willing to supplement the team. So if we have more people doing coverage, then that certainly can help us with our burnout situation. So we're working that. we're also working kind of the bigger picture of what this will look like more long-term. Obviously, the county and the public safety reform conversation needs to continue. Unfortunately, their timeline isn't really as acute as ours is right now. We have a very real issue in front of us that we're trying to address here in the short term, and then be a part of the larger conversation. I think, as others have mentioned, we need to be as the community moves forward, developing what it wants. The response to what now have been traditionally law enforcement calls that maybe could be handled in a different manner. So I have told the county administration leadership that you want to be a part of those conversations, and that really what they're looking for is the Community Justice Center, the CJC. I always forget what it stands for, but they're looking to hire a couple of people as part of that project, and they're really looking for those folks to be on board to kick off kind of the next step of figuring out what implementation looks like related to the public safety plan. That's still several months away, likely probably the end of the calendar year before they're onboarded, get their feet underneath them, and really are moving forward. So we're trying to look at both the short term and the long term to make sure that we can continue providing the services that we have been, but also be a part of the conversations for the longer term solutions around community response to mental health, substance use, and disability concerns in the community. So I just wanted you all to be aware of that. I think there was some concern the mobile crisis team was going to go away. That is not our goal or intention, but we have to have people to staff it. So we are working hard to try to create an environment that is more doable for the staff that have been working it. And then again, continue the broader conversations beyond that. That's really all I had, Mary, and I'm happy to answer any questions anyone has.
Any questions for Frank? Larry?
So the other day I read an Ithaca Voice report about an incident at Cars. And I wanted to say that I think reading between the lines, it seemed to be handled really effectively. And I hope that we can get more stories about how effective we are in addressing crisis into the paper. I know they didn't call and ask us for a comment, but I thought the article was pretty well done, and that it looked like everybody was okay. I mean, I'm sure it was a difficult situation, but I also think that it showed that when crisis like that happens, there are effective ways of responding.
Yeah, no, it's a good point, Larry. And I do think the coverage was positive. I think generally speaking, things went well. We did have a staff person that was responding with IPD to help. But I think across the board, it had a positive resolution. As far as communicating about those events, that's something we've got to look at. We've had this conversation before. We're always hesitant out of privacy concerns for that individual, right? If there is a law enforcement connection, that part of it can become public in those types of reports. But our law enforcement is really good about being sensitive to people's privacy, and we try to do that as well. But that doesn't mean we need to tell the stories, and we need to figure out how to do that. We're actually in the process of trying to bring on a communications coordinator for the joint department. It will be part of the health promotions program at the health department, but we have a job description. I'm hoping that will be advertised relatively soon. And we're looking to bring somebody on board to help us kind of capitalize on our profile as it's been built over the last year and a half, and really leverage that into getting our message out about these other issues that are just as important post-pandemic.
Okay. So we're at the point in our agenda, unless there's any other questions, where we're going to be going into executive session. So anyone who's not a member at this point should sign off. Thank you, Sally, again, and Suli for coming. Appreciate it.
You need a motion to go into executive session.
So can I have a motion to go into executive session to discuss board membership? Okay, Travis and Paula. So we are in executive session. Thank you.
Oh, there's Greg. Greg, you'll stop the